Hello, everyone. It's Friday, August 27th, and regretfully, we have an additional 18 more deaths. You know, we tell everybody over and over about getting vaccinated, and we got some alarming statistics we'll get into in just one second, but the 3,037th death is an 84-year-old male from Marion County. The 3,038th death, a 50-year-old male from Nicholas County. The 3,039th death, a 78-year-old male from Raleigh County. The 3,040th death, a 92-year-old female from Raleigh County. The 3,041st death, an 81-year-old male from Cabell County. The 3,042nd death, a 64-year-old male from Upshur County. The 3,043rd death, a 76-year-old male from Marshall County. The 3,044th death, a 92-year-old female from Berkeley County. The 3,045th death, a 50-year-old male from Monroe County. The 3,046th death, a 68-year-old male from Upshur County. The 3,047th death, an 81-year-old female from Nicholas County. The 3,048th death, a 94-year-old male from Marion County. The 3,049th death, a 66-year-old male from Pocahontas County. The 3,050th death, a 69-year-old male from Roane County. The 3,051st death, a 54-year-old male from Berkeley County. The 3,052nd death, a 36-year-old female, gracious sakes, from Morgan County. And the 3,053rd death, an 86-year-old female from Fayette County. And the 3,054th death in West Virginia, an 83-year-old male from Kanawha County. Again, we cannot let them just become a number. Please don't let that happen. You know, from the standpoint of our numbers today, in the last 24 hours, we have 1,328 new positive cases in West Virginia. The daily positivity rating is at 10.94. The cumulative number is at 5.13. The total number of active cases in West Virginia now are 13,766. We have 547 people that are hospitalized and 178 people in the ICU units. We have one green county in West Virginia today, and 35 of our 55 counties are red. As far as school outbreaks, we have 20 school outbreaks in 13 counties. And again, I caution you, I tell you over and over, if you're 65 and older, absolutely, and you have any feelings whatsoever of sickness, you need to go get a test. The antibodies will save your life. And without going any further whatsoever, our flags are at half staff. We had a terrible situation that has happened in Afghanistan. We lost many of our service members. Last night, the report was 13 were dead and all kinds of wonderful other people that we've lost. 13 people last night. I don't have an update beyond that right at this point in time, but 13 brave heroes that we lost, and many are injured and in the hospital and are in really tough shape. Please, all of us, join together in prayer for them in every way possible. Now today we have some really special guests with us. We have the United States Secretary of Education, Miguel Cardona, is with us today. And Secretary Cardona, has a daunting task for sure, but a terribly rewarding task. And you'll hear from him in just a few minutes. In addition to that, we're joined today by our West Virginia Superintendent of Schools, Clayton Birch. And you'll hear from both of them very shortly. I want to just say this again, that everyone is committed to one thing, and that is getting our people vaccinated. Now, we've done great in West Virginia. I mean, if you just think of the people that are 65 and older, we've got more than 90% of them vaccinated. And the 50s and olders, we're right on the threshold of being at 85%. Now, that's great. But our total population still lacks a lot of our young people that we need to get vaccinated. So I'm totally committed to doing a back-to-school vaccination for those 12 and older. And if and when the vaccines come out that the CDC and everybody recommends, and we're able to do 12 and under, we'll absolutely be ready, and we stand ready to move and move very quickly. We've done all kinds of things, you know, from the standpoint of these baby dog sweepstakes to anything and everything we can possibly do to market, to be able to get people to the finish line and get them vaccinated. You've got to be able to see everything is right in front of you, that everything points towards one thing, and that is you have to get vaccinated. We have got to get vaccinated. The more that are vaccinated, the less that will die, for absolutely certain. That is absolutely the way it is. So I'm going to turn now to our superintendent, Clayton Birch, and Clayton does a fabulous job. He's a great friend. He does incredible work. So I'm going to turn it over to him and let him go from there, sir.
Governor, thank you very much. And you know, it feels like every time I'm here, I continue to echo just how appreciative we are of your continued leadership when it becomes, you know, not only the vaccinations, making sure we have the resources we need. You know, I go back to being one of the first states in the nation that prioritized our school system and our educators all the way back in December and January. Back in May, as many of you know, we launched the I Got Vaxxed campaign to really tackle during the summer months. Each of our 55 counties offered a summer programming, very robust. We've given reviews on that, but I think one of the things we might not have highlighted enough is just how much effort those summer programs put into vaccination clinics locally. Both for our teachers, service personnel, adults in the community, our school systems have really stepped up to host those community clinics. During the summer, they targeted children 12 and over, and now as school has started, all but 2 counties are in session now, coming back for consistent in-person education. And that campaign has tweaked just a little. We've changed the campaign, and it is now I Got Vaxxed to Get Back. And listening to the students out there and teachers, the I Got Vaxxed to Get Back is really highlighting that need that students want for consistency, some sense of normalcy. So hearing students talk about I Got Vaxxed to get back to proms and homecomings and football games, you know, they're really, really dire to be back to some sense of normalcy. As you heard the governor state, there are 20 outbreaks total in the state of West Virginia right now in our K-12 public schools. There's over 700 schools in the state of West Virginia, so they are being tracked just as we did last year. They're online. We post those, and we want everyone to know that we not only are committed to holding in-school vaccination clinics, we're committed to holding them in every one of the 55 counties, and I must applaud each and every one of our county superintendents, but also our county health officials. Just as we do here at the state, we do listen to our state health officials, and our county superintendents rely on those local health officials to guide them through this process. We really want them to be in a position so they could track and monitor locally what their needs were, specifically down into schools, into classrooms, and pinpoint where those mitigation strategies are. So with that, I also want you to know that now online, you can go to the COVID website on the Department of Education, and you can actually see a snapshot of every single county. The demographics we've been putting up there of all of their pandemic funding and their plans, and now with that, we also are putting up there any changes to a county's mitigation strategy as they are being very reactive as they need to be and pivoting as they need to do. Seems our efforts haven't gone unrecognized. As the governor stated, we do have the U.S. Department of Education, and Dr. Cardona is going to be introduced here by the governor in a bit. And you know, I think it's important to thank the U.S. Department of Education and Dr. Cardona. They've been essential as we've talked about recovery and getting back to some consistency. And I think the partnership between the governor and now with Secretary Cardona just enhances what we all know is important. So with that, Governor, Secretary Cardona, I think the Department of Education, the Board of Education, our county superintendents, you know, we want to thank you both for your leadership, but also just the sheer amount of resources you've provided to make sure that our students have a chance to be back in school as consistently as possible this year. So with that, thank you.
Thank you, Clayton. Thank you so much. And is Secretary Cardona going to come on now? Okay, well, Secretary, thank you so much for joining us, and it's really an honor to have you. So thank you so much, sir.
Oh, thank you, Governor. I appreciate the invitation. I'm really glad to be here with you all in West Virginia. And, you know, the statistics that the governor mentioned at the beginning, I think that should drive us, right? We're all in this together. This is about protecting lives. This is about getting students back into school. Thank you, Superintendent Birch, for highlighting what this actually means, right? When we say we're going to increase our vaccination numbers, what we're saying is we're going to do our very best to make sure that students can get on the field, that they can have in-person learning, that they can enjoy those experiences that we all know are so important for school success and just those, you know, those experiences in our schools. So Governor Justice, thank you for your leadership, and Superintendent Birch, thank you. This is a tough time to be a leader, but you know what? It's an important time. We can come together as a country to do what's right for our students and for our population. And I'll tell you what you did in West Virginia to require the vaccination pop-up clinics. Not only did you, accept the call to action, you really elevated it and said, we're going to value this throughout the state of West Virginia. So thank you for your work on the I Got Vax campaign. I love what you're doing. You know, you're offering money to schools that have the highest percentage just to kind of make it a fun challenge. This is really about ensuring we're doing everything in our power to give students an opportunity to engage in in-person learning that's uninterrupted. Because as you know, across the country, our students have paid enough. They've had to sacrifice enough. Let's get them back into school, and let's make the school year the best school year for them. They deserve it. So I thank you for doing what you're doing to make it something that's required in the 55 counties, and all the efforts that you're doing to get shots in the arms of everyone, not just our youth. But we know that our youth numbers need improvement across the country. So what you're doing shows strong leadership. Thank you for doing what you're doing. And it's a team effort, man. We're on the same team here. So your leadership matters. And listen, if you're not doing it to get the numbers up or to win money for your school, do it for Baby Dog. You know, there's so many reasons you can do that should motivate you. Thank you for what you're doing in West Virginia, Governor Justice. Thank you for your leadership, Superintendent Birch. Thank you for your leadership and the whole team. I know it takes a whole team to get this done. And I wish the very best for the students that are going into school. And I hope the students and educators have the best year yet. Thank you again for having me.
Secretary Cardona, thank you so much. I got a little special prize for you. I got a little buddy here that wants to say hi to you. Now, how about this little thing? But she loves you too, and she wants our kids back in school. We're going to give 30 full scholarships to kids that get vaccinated at any of our institutions. It's a $100,000 scholarship for 4 years. And wow. So anyway, we love you, and we tried to make you smile here a little bit. Thank you so much. You did.
Highlight of my day so far. Have a great day, West Virginia, and good luck. And I'm behind you. Thank you.
All right. Thank you, sir. Thank you for coming on. Okay, we appreciate the secretary. We appreciate our superintendent, and I've lost my mic now. Okay. All right. You guys, why don't y'all take her right now? Y'all can take her, cause and. Well, yeah, you got to take her. Okay. I know you'll hear from Dr. Marsh and General Hoyer. You know, I wish so much, and I want you to really pay close attention to me. I am not an advocate of mandates. I am not an advocate of masks. We've been through enough. We've really been through enough. But at the same time, we have some way, somehow stayed together. You know, I really warn everyone that as we fragment, we will absolutely only escalate things to the worst. You have got to pay really close attention. You've got to pay really close attention to the experts. Nationally, we have seen an overwhelming majority of the people that have COVID or have this Delta variant that are not vaccinated. West Virginia is not immune to that. West Virginia is experiencing the exact same thing. And that is that overwhelmingly, the numbers in the hospitals of folks that have COVID, have the Delta variant, are not vaccinated. 85% of those that are in the WVU medicine, arena that are hospitalized and have COVID are not vaccinated. At Mon Health in Morgantown, it's 92% of those that are hospitalized haven't been vaccinated. At CMAC's hospitals in Charleston, it's 80% of those are unvaccinated. At Thomas Health Systems, or Thomas Health Hospitals, over 90% of the patients are unvaccinated. And now get this, 100% at Thomas Hospitals, at 100% of those that are in the ICU units are not vaccinated. You know, we all got to know, hands down, that vaccinations are the ticket to stop this thing. None of us want masks. Surely, to the Lord above, none of us want the mandates. None of us want to be fragmented and run in all kinds of different directions. You'll hear 25 different people or 100 different people or 1,000 different people that think they've got it all figured out on what to do. But I'll promise you, the people that we have that have led us through this pandemic know what to do. And what to do is get vaccinated. That's what to do. You all know that Pfizer was approved by the FDA just the other day on Monday. On Monday, I told you that we have directed our team to be ready to go in every way to administer the booster shots just as quick as we have the go-ahead. We do not have that go-ahead yet. We are working it as hard as I know how you can possibly work it. And absolutely, from the standpoint of the National Guard, the health departments, the local pharmacies, the healthcare facilities, we're all ready to go. We're ready and as ready could be to go. But we do not have the go-ahead from the federal government. You know, West Virginia came right out of the blocks, led the nation, and then by leading the nation, we had people vaccinated early, and by leading the nation and having them vaccinated early, we ought to be able to give our booster shots early. You know, Dr. Marsh and General Hoyer talked with the White House this week, and they're pushing every direction and every button that they can possibly push. As far as vaccine updates, we had 4,300 doses that were given since Wednesday. It sounds great. You know, I don't know how long it will take or what it will take for you to really hear me and hear me very clearly. 4,300 additional people, we've saved some lives. We surely have. Maybe we've saved some significant lives. But in that, is that enough? No, it's not enough. We have got to get more people vaccinated right now, especially our kids. But we have got to get more people vaccinated across the finish line right now. 4,000's good, but 4,000's not enough. We right now have 91.1% of the people that have one dose. We have 84.6% that are 50 and above that have one dose. And that's 91.1% of those 65 and above. You know, from the standpoint of the total population that's eligible 12 and above, we have 71.4%. You know, I don't know. You know, I've got one thing that I've got to read to you right here, and I want you to just imagine this, and this is real, and this is the balancing act that's going on all across our state and in many places in our nation right now. Local health departments. Now, can you just imagine? Can you imagine local health departments receiving death threats? Death threats to the very people that ran to the fire, saved our lives in every way, were courageous beyond belief, and some of them have probably gotten so sick that we've lost them. Can you imagine that they're receiving death threats from people that are saying that they are responsible for mandating masks in the schools? Now, we've left that up to the local boards of education, the local school superintendents, because we feel like they have more knowledge than we have in Charleston, and we've tried to give as much local control as we can give. The health departments don't have anything to do with it, but for God's sakes a living, death threats over a mask? You know, I mean, do we really need to get to this? I mean, this is an absolute shame, and surely to God above, we'll stop threatening the very men and women that work so hard to save our lives. You know, I just can't get it. I really can't get it. I don't want the mask. You don't want the mask. If the local people believe that we are absolutely in a situation to where the kids should wear masks, let's be respectful to what they believe. They may not want to do it either, but at the same time, that's what they believe. So let's at least honor their beliefs as well and absolutely not get to this level. I mean, we do not need to be doing this to the very people that saved us. The other thing is, and I'm not going to go all through this again, you know, we're trying to incentivize everybody we possibly can to get their vaccines. Vaccine eligibility is 12 and above. Your natural immunities are not enough. Whether you believe that or not, you should still get vaccinated. We got your young people, we still need them across the finish line in every way. All the stuff on free testing, I've told you over and over, there's no point in going through that. We now have 40 outbreaks in our long-term care facilities, 6 outbreaks in our church community, 6 counties, that's Barber, Doddridge, Kanawha, Mason, Taylor, and Wayne counties. We have 49 people that are inmates that have this, and 42 staff. And I remind you over and over about giving blood. The only thing I would say is just this. We had 18 more people die today. 18 more people died. What's it going to take? What is it going to take? I mean, what's it going to take for us to realize just this, that no matter what, we want to have school, don't we? And we want our teachers to be in school, and our service personnel and all those that are helping us be in school with our kids. We want our kids to have a normal year. We want absolutely to not have any of our businesses closed, and God forbid that would be catastrophic to everybody. We absolutely want to be able to worship and stay in harmony with one another in every way. Now, what will ensure all that to happen? Just that. We don't want to wear masks. We don't want to have mandates. We want to go to school. We want goodness all around. What will ensure us of having that happen? Vaccination. That's it. That's it. And if we choose not to have that, then all of those things come into play that can disrupt our lives in every way. Jim doesn't get it. I don't get it. That's all there is to it. If that's the only thing we had to do, and we know how incredibly safe they are, and we know that absolutely it could very well save lives, we know it will save lives. And those of you that are out there in the world that, are so-called the hell knowers and everything, you can get just as upset if you want to get upset and everything. I am trying to help you. I am being very respectful of you, and I expect you to be respectful of others. I am trying to help you. I am not adverse to how you feel. I personally feel like you should get vaccinated, but on the other hand, I am not being critical of your beliefs in any way. All I am saying to you is just this. Without any question, if we had more people vaccinated, less people would die. There's no question whatsoever. I just read 18 great West Virginians that we've lost since the last time we were together, 2 days ago. 18 West Virginians we've lost, almost 2 Sago mine disasters in 2 days, almost 2. And we're going to act like, and that's, we have gotten to the point in time where we're going to accept this. We're going to say, well, that's okay. That's okay. Let's just keep doing everything we're doing. It's okay. Well, it's not okay. 2 Sago mine disasters in 2 days to just say, well, that's okay. That's just part of life. It's just not okay. We need to try with all in us to stop this. This terrible killer is with us. And absolutely, if we begin to fragment, we'll absolutely have more problems than you can possibly have. We are right on the verge. Now, everyone needs to hear this too. You'll hear it from Clay Marsh. I know it. I know it. The whole thing is the $64 question is how much will the mask even help us? But I know this, that our healthcare system is absolutely going to be pushed to the brink for sure, and absolutely if we're not closer and closer and closer right now to the wheels coming off. I'm telling you, West Virginia, with 35 red counties, I'm telling you with all in me, you need to go get vaccinated, and you need to run to get vaccinated today. That's all I got right now.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, thank you, and good morning. I have to say, listening to the governor's comments, it makes me really reflect on making sure that we level set with what we're trying to do here and what's going on. So as the governor said, this is not an effort to be contrary or to be punitive to anybody. We all believe deeply in people's individual rights. But we know that this Delta variant, which has now taken complete hold in West Virginia and is growing, is going to be worse before it's better. We know that our hospitals are starting to fill up very rapidly. We've seen about a 13-fold increase in numbers of people in hospitals and ICU beds on ventilators, to the point where we now have established that we need to increase our most highly sophisticated sets of technologies that can really bypass the lungs in people that are so sick that they can't oxygenate their blood anymore. And there's machines that are used basically in heart surgeries that bypass the cardiac bypass machines. And currently, we have so much call for those machines in West Virginia that we see the need to expand them, because even our most sophisticated critical care capabilities on mechanical ventilators and people that are highly trained to be able to help patients make it through is not enough, because in some people, and these people are almost all, if not all, unvaccinated, that the impact of the COVID infection is so overwhelming that without going on basically cardiac bypass, they can't survive. And we see that, and we know that full vaccination protects us from that. At any time, being fully vaccinated will protect us from that. And we've seen that over and over again. A recent study from Los Angeles said the risk of severe disease, hospitalization, ICU admission goes down by 29 times if you're fully vaccinated. So we know that vaccines are not just, prevention measures, they're treatments. They're treatments that help keep us safe, help keep us well. And as the governor said, the thing that's the most scary about this is our number of cases is rising at the second fastest rate in the country per Becker's News. So we are now number 2 in the country at the rate of increase in the new cases of COVID-19. And in our country yesterday, we lost 2,200 people. We haven't seen that kind of death rate in our country since the winter. And that is in one day dying of COVID-19, the equivalent of 9/11. 9/11 was about 2,900 people. That was 2,200 people. So we have become sort of callous and not really understanding the real impact of this. But in 2 states, Alabama and Arkansas, they ran out of ICU beds. And in other states, they're running very low. And we will be in that same position if we don't act now. So the governor's instructed us to talk to the federal agencies. And we've talked to the Centers for Disease Control. We've talked to vaccine manufacturers. We have talked to the White House. We have talked today to the Food and Drug Administration. And we are working every angle to be able to try to get our most vulnerable population, who are vaccinated first in this pandemic, another booster shot, because we know in Israel and other places that at 6 months or so, the potency of the vaccines drops some, but still incredibly effective. The people that are in the hospital, the governor just said, are almost all unvaccinated, between 80 and 98% in our hospitals. And if you look around the country, it's about 85 to 88% of people in hospitals are vaccinated, and the rest, some 85 to 88% are unvaccinated. The rest are having vaccine breakthroughs, and the people having vaccine breakthroughs are the most vulnerable, oldest people who need another shot. So they need an even additional shot, but we want so badly for the people who haven't been vaccinated to please do that. Save your life, save your family's life. The best thing we can do for our children who are not vaccine eligible is have the parents fully vaccinated. And once you're fully vaccinated, then we would advise, because of the red counties the governor talked about, that people consider additional mitigation measures, including wearing a mask when you're indoors around a lot of other people, or in crowds, or with people that you don't know. And just be mindful, keep your distance. If you're sick, get tested. If you can do a lunch outside versus inside, do it outside. And maybe right now, just be careful, particularly if you're in that vulnerable over 50-year-old population or older, particularly with pre-existing medical problems, because in Israel, those are the people who had vaccine breakthroughs who ended up in the hospital, people over 60, 65 years old, other pre-existing medical conditions, and the boosters help them. But the truth in Israel, in the United Kingdom, in parts of, in the United States, is that fully vaccinated people are well protected against severe disease. Is the potency dropping a little bit? Yes. But the truth is that the people that we're seeing dying today are the unvaccinated part of our population. And so we really, really plead with you right now to take the choose to be fully vaccinated, because doing that, you likely will save yourself an illness or a severe illness or dying, but importantly, you'll protect our children, you'll allow our children to stay in school, and you'll also protect our hospital system, because right now we're seeing a rate of increase of growth. Our updated numbers, about 571 confirmed folks in the hospital today, and about 612 confirmed and suspected of COVID-19. And those numbers continue to rise every single day. And as we're seeing in the US, they're rising around the country to a number we haven't seen since the former peak. And the last thing I'll say is when we compare the rate of speed of our hospitals being filled with folks with COVID, this surge with the Delta variant versus our largest surge, then we see that we are filling those beds about 90 days faster this time than we did last time. So at this rate, our hospitals are going to very quickly come to capacity unless we all run to this fire. And run into the fire is getting fully vaccinated, being careful, layering on additional mitigation measures like masks and physical distancing, and get tested if you have any symptoms of cold or infection, or if you're around somebody who has been defined as having COVID. And we know that for vulnerable people, there's other options like the antibodies, but we can only get that to people if people get tested. And we hope that by talking this way, then some other people will run to the fire with us, and that will help save many other lives in West Virginians, because it will keep our hospital system running. Thank you.
All right, thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good morning. Just like to reinforce the efforts that will be going on that the governor discussed earlier, working with Secretary Birch and his team, the Interagency Task Force, and all the local county community groups that we have pulled together that include the health department, the county boards of education, the FQHCs, the pharmacies, the volunteer groups, will all be working to make sure that we have available, in coordination with the State Department of Education and the county superintendents, vaccine clinics available at all of our school locations that they deem the best places to do that, so that we can continue to vaccinate our population in our school system. Thank you.
Thank you, sir. Next is Secretary Bill Crouch with the DHHR.
Hello. As Clay mentioned, there is technology out there now that can assist some individuals who have serious complications from COVID. The governor asked DHHR earlier in the week to work with WVU and CAMC to increase ECMO services, which is extracorporeal membrane oxygenation. These are a place that have heart and lung machines. So the governor has asked us to work with WVU and CMC to increase these services by providing some funding to both institutions. Over the past few days, we've moved quickly to fund an additional 7 ECMO machines in the state. The existing capacity in West Virginia with these 2 facilities is 11 machines, so we're increasing that by 7 up to 18. That will take some time to get that equipment in, and more importantly, to get individuals trained. This is a service that requires highly skilled individuals, nurses, that require staff around the clock to sit with these patients with these machines. So it's very staff intensive. These are life-saving machines for some individuals experiencing acute respiratory and or acute cardiopulmonary failure. These machines are not for everyone, but for those who need them, they are truly life-saving. I want to thank WVU and CMC administrators Albert Wright and Dave Ramsey, and especially Dr. Tom Takubo and Dr. Jeremiah Hyanga with their assistance in getting this information together. I also want to thank the nurses and the respiratory therapists and pulmonologists and those on the front line in these facilities. Again, as the governor always says, they run to the fire. They're saving lives, and we thank you very much for what you do.
Thank you, Secretary. Dr. Ayan Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I was hoping to get an update on our surge overflow hospitals. I know last year we spent, a considerable amount of time and money setting those up in case we needed to utilize them. Where do those stand today, and do we have the personnel to staff them if need be? Thank you.
General Hoyer, you got to do this, sir.
Yes, sir, Governor. So Charles, Secretary Crouch and the Interagency Task Force team working in support of DHHR have continued to work with our hospitals for available bed assets. Right now, bed assets, as Dr. Marshall pointed out before, are not our issue. Our issue right now continues to be making sure that our hospitals have the capability of staffing and the equipment that Secretary Crouch pointed out earlier. So we are tracking every day available bed capacity and have the ability to turn on additional capacity under the Secretary's leadership if needed to do so. But right now, staffing and equipment will continue to be our challenges.
All right, thank you, Charles. Next to Bob Aaron with WCHS and Fox 11.
The governor, in some of his remarks, has indicated he doesn't seem to think that masks are terribly effective against the Delta variant. How does it actually spell out, if I, as a person, wear a mask, how much protection do I get? And if the other person is required to mask and also has a mask on, how does that change that equation? And how does this all work out when we have such a patchwork of policies as to whether a courthouse or a school system or a county is masking? How does it work out when our only public health policy seems to be everybody needs to get the shot?
Bob, let me point out just, from the standpoint of how the masks work, or how effective the masks are, I think Dr. Marsh can tell us a lot more about that in just a second. But the bottom line of the whole thing is what kind of mask have you got on? If you got a mask on that you can see through it, well, that's not going to do any good at all, or not going to do much good. Have you got masks on that aren't sealed, to your face and everything? That's going to be surely not as good as the mask that are really good and that seal right directly to your face. But whether it be you've got people that wear masks over their mouth and don't cover their nose. Well, that ain't gonna work. So there's all those things, and Dr. Marsh, maybe you could talk just a second, then I'll come back.
Thank you, Governor, and thank you, Bob. So data from the CDC would suggest, as the governor said, with this really highly infectious form, and really the Delta variant, which is that form of COVID-19, should be considered almost a separate disease. It's recently been referred to as the most infectious respiratory virus, perhaps in our history. That may be a bit of an overstatement, but this Delta variant spreads so differently than other forms of COVID-19. It should be considered independent at this point. So a tight-fitting mask that you can't see through, as the governor said, will provide, according to the CDC, about a 40 to 60% reduction in the amount of aerosols and droplets that one will generate, but only about a 20% reduction in the filtering capacity, the reduction of having that virus hit your nose. The more people that wear the mask in the environment, the better. But as the governor said, it needs to be with masks you can't see through, which are 3 or 4, plies, separate sections that separate you from the outside, or a fitted, very high barrier protection mask like an N95 mask or a KN95 mask. But I think that the real answer to that is masks certainly do help some, but given the infectious nature of this variant, we really like to talk now about layered mitigation strategies. And the really most important by far on a scale of 1 to 10 and 8 is getting fully vaccinated, on a scale of 1 to 10, mask alone are probably about a 4 or a 5, and together they're like a 9 or more. So we really do believe vaccines are so important, but we would advocate for people who choose to wear masks, to wear them correctly, wear them tight fitting around the face. And and when you're in these conditions in indoor environments, et cetera, they can benefit people who wear them.
And come back to me just 1 second, Jordan. Bob, you asked the question, if one county has one set of rules and another county has another set of rules, local control and everything, I don't know how that really helps, and we'd be better off with a standardized rule all across our state. And you may be right, to some level, but then, you could even argue, well, if we've got a standardized rule across our state, are we going to stop everybody from out of state coming into the state? And I know on our turnpike that 76% of the traffic is out of state, so there's all, so then you get into local versus state and state versus national. And so there's all kinds of different things. The bottom line is, locally, we have more local knowledge than we have at the state level to what's going on in a certain area of our state. And so therefore, we've tried to give more leeway on a local situation, and from the standpoint, Bob, of, the mask, this is really not about the mask. This is about the vaccines, and I know you know that. I know you're trying to help in every way, and I appreciate all that you're doing, and you continue to do every day. I mean it. I mean that very sincerely. But 80% of the states in this country are doing what we're doing today in regard to local control and that kind of stuff. And I don't know that specifically, but I've just been advised that that's the case. But with all that, I know without any question that the local control, the local folks know more than at the state level. And the states know more about their states than the national people know about West Virginia or all the particular states. But I do know today, and we're monitoring this like crazy and everything, that 80% of the states don't have a mask mandate out there today. And so we're trying to hold this thing together as best we possibly can, protect our people as best we possibly can, and hoping and praying that this surge that we're in right now reaches a peak and starts, heading down the mountain instead of continuing to grow. The only thing I would add, and I just made these notes just a second ago, is we read 18 people today. We've lost 3,054 people in the state of West Virginia. We know that the vaccines will absolutely curb and stop this thing. And the only thing I would tell you is we're growing, and the experts are sitting there telling us that we're going to max out at our hospitals if we don't watch out very soon. It's not winter. It's not winter time yet. When winter comes, we're more together. Absolutely, it's not winter time yet. And this thing could get really bad. Our ticket is without question the vaccines. Okay.
All right, thank you, Bob. Next, we'll go to Mark Curtis with Nexstar Media.
Good morning, Governor. Good morning, everyone. Let me first echo the comments from Secretary Crouch just moments ago, saluting the frontline workers. This past Tuesday, I was at the Shawnee Sports Complex here in Kanawha County. It was well over 100 degrees on the pavement, but there were all the frontline workers out there giving shots and giving tests cheerfully. Yesterday, I was at the Kanawha Charleston Health Department twice. This morning, I was at Health Right West Virginia on the East End. Both places very, very busy. And I just want to salute Dr. Sherry Young and Dr. Angie Settle for the organizations they run and all their frontline workers. These people are remarkable, the job they're doing. They are the foot soldiers in this fight. Now on to my question. I want to direct this to Superintendent Marsh because we didn't get a lot of specifics from him or Secretary Cardona about these vaccination clinics. Are they going to be in every middle and high school in the state? Would these be public and private schools? When do they start? How is this going to work? And are we getting any federal funding to make these vaccination clinics happen? And by extension of that, might some of these clinics move to the football fields as well?
Mark, thanks for your question. And I think that's Superintendent Birch that we're going to send this to and everything. So Superintendent, we'll put you on here.
No, that's fine.
And Clayton, you can be superintendent sometime too, but we'll go with Superintendent Birch today.
So, yeah, thanks, Mark. These are actually a continuation of what we did this summer. So our vaccination clinics were around the counties. What the counties did is they typically picked some central locations, usually at a high school, sometimes at a middle school during the summer. As they shift into the fall, what we're going to see is that they're going to do the similar thing. So they'll be holding these vaccination clinics in some central locations. I can't guarantee every single school, but the counties will select the schools and locations where they think they'll have the biggest impact. Sometimes we'll see them actually move them around. And it's actually funny that you mentioned the football games because we have heard many of our superintendents talk about having vaccination clinics. Not only, and I want to reiterate this, these clinics are not specifically just for the 12 and older. I mean, these school systems are opening many of these clinics up to the entire community so that when they're able to do these clinics, even in the football games or any type of evening events, they want to make sure they capture as many of the community members as possible. And yes, wonderful collaboration as usual with DHHR and Secretary Crouch. As a matter of fact, the most recent partnership with them, they have provided funds, and I believe majority, probably higher than 90% of the counties actually took advantage of the funds to hire and get support for a full-time person to organize those for them to make sure they have the support to keep those running throughout the school year.
All right, thank you, Mark. Next to Katie Ree with WDVM.
Hi, Governor. Hi, panel. Thanks so much for your time. Going back to schools, you mentioned earlier in the press conference that there are 20 school outbreaks in 13 counties, but yet you're still against a mask mandate, and you're still leaving that up to those local school boards. But in the state of Maryland, they have implemented, or at least voted on, a mask mandate throughout the school systems. I guess, what are your thoughts on that?
My thoughts are just as simple as I've said over and over. I think that what we should do is leave it to the locals. I know that I don't know exactly the number, but I think it's 18 counties now have mask mandates in the state. I think that the local people can make a better decision on this than we can in Charleston. But I also know just this. I know that that the very second that we jump up and put a statewide mandate down, you're going to have an uprising, of people that are going to try to reverse that, and then right from that, then you're going to have a total fragmentation of us. And if we begin to fragment and everything, it will cause us to be in a worse position than we are right now. And I want to, go back to, Secretary or Superintendent Birch rather, and maybe he can add a little bit to this.
No, Governor, I think you're absolutely right. And to the point of 20 outbreaks, schools have been going since August 9th. We knew there would be outbreaks. There were last year. But a couple things to keep in mind, that even these county superintendents that have to make these decisions locally, they do so with their local health officials. It's a wonderful collaboration. They work together. These are not easy decisions to make. And what we've also heard is that in some of our larger counties, some of these mandates across the counties aren't even county-wide. Sometimes the mitigation strategies they have to consider are even pinpointed down to the individual schools and sometimes the classrooms. And that's the ability they have that we do not have when we try to do statewide mask mandates. So I was able to be out in the communities last week. I want to thank Summers County. Our President Miller Hall was down there. I was able to be in Nicholas, Mineral, Hampshire. And in particular, there's a little elementary school in Hampshire County. It's Springfield Elementary. And the staff was wonderful. They were getting their rooms ready for the children, and I got a chance to sit down with them. And, I think two things were the biggest takeaways from that travel last week. And one was being thankful that there was local decision, thanking the governor, the West Virginia Board of Education, that they got to make those decisions locally. But secondly, the group of teachers at this little elementary school in Springfield, West Virginia, talked a lot about lessons learned last year and the caution they gave me as the state superintendent, and I think they would appreciate that I shared that with the governor, is you've got to keep our children in school as consistently as possible. We cannot have them away from us. And that group of teachers, I just want to tell you that it meant a lot to me, and they were pretty passionate about, no matter how bad it gets, that we have to do everything we can to keep these children consistently in school.
And come back to me, Jordan. Think about our superintendent, Clayton Birch. Think about what he just said. And I've got to just go there just for a second. Think about the courage that it takes for teachers to step up and say just that. No matter how bad it gets, I'm going to be here. I want our kids to be right here in school. We all know that absolutely our kids need to be in school without any question. And we all know that that is real courage, and absolutely those people should be, admired and thanked and appreciated beyond belief. They, all the healthcare community, all of us, everybody is trying to run to the fire. All we ask is one thing, and that is just this: for people, as we are respectful of all their rights, to just think of all that is on the line right now. Absolutely, those kids going to school. Absolutely, those teachers going into an environment that is dangerous as it can be. Without any question whatsoever, all in the world we continue to ask for is that people get vaccinated. If they're vaccinated, we can stop this thing. And if they don't, it's just going to be a bear to handle. And so, I don't have anything else on that. Go ahead.
All right, thank you, Katie. Next, we'll go to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Governor, we have 50 pounds in a 25-pound bag today. A lot of information out there. I want to go to Superintendent Birch on this one. Clayton, you're on the front lines of the parental debate. A lot of people say mask, a lot of people say no mask, vaccine versus no vaccine. As you're traveling around to these counties, are you getting a sense of what the parents are saying? And if there is a community conflict out there brewing that Governor alluded to that needs to be tended to before it gets out of hand? Thank you.
Yes, sir.
No, I think that what the governor alluded to is correct. I think there is quite a debate, and I think it goes back to what I said, that these superintendents and principals and teachers, they do not make these decisions. They don't take them lightly. But I will say this, I always remind folks that my own children in school, they go to different schools, whether it be higher education or public high school, and, I'm a parent in that community first and foremost, and I'm going to back my school up. And I think that's what we typically see, is that we may, as adults, have some controversy over we agree or disagree with masks, but I think oftentimes when I'm out there, what I do see is that when a school or a district steps up, makes a decision, decides this is what we're going to do, I truly believe for the most part, the majority support their local school systems. And I think that is the beauty of really asking these folks to take on that heavy lift and do these decisions locally, because they do know best. And if they are controversial, if it was in my own community, I'm going to trust my teachers, I'm going to trust my principal locally with my children, and I believe that, again, locally is going to be the best decisions they can make.
All right, thank you, Paul. Next to David Beard with the Dominion Post.
Hi. I think my question will best be directed to Dr. Marsh, but I need to lead up to it. We know that our information about these viruses keeps evolving, but there are people who use that evolving information to say it's all inconsistent. We don't know who to trust. And so why should I bother getting vaccinated? Why should I bother wearing a mask? Because you can't believe anyone. So just last week, I think we mentioned that people who've recovered from COVID shouldn't rely solely on that for immunity. They should also get vaccinated. But then today I read in Bloomberg in that study from Israel, or that research from Israel that we've talked about before, that people who've had COVID and recovered are actually more protected against Delta than people who have had the Pfizer vaccine. I'll just read one sentence from the article. It says oh great, it disappeared. Anyway, here we go. People given both doses of the Pfizer vaccine were almost 6-fold more likely to contract a Delta infection and 7-fold more likely to have symptomatic disease than those who recovered. So I guess people who oppose vaccines or fear vaccines are going to jump all over that. And so I wonder if we could put that in some perspective. Thanks.
Before I go to Dr. Marsh, David, and this is really interesting from the standpoint of, there's no question that data continues to be fluid and continues to evolve. There is no playbook. We have said this over and over and over. It may very well be that what comes out at the end is that people that have had COVID didn't need the extra vaccination. But if they got vaccinated, we also know that there's not been any adverse effects of getting vaccinated. The thing that I don't understand is just this. If you had the choice between getting vaccinated today or maybe the best path is go ahead and get COVID and be sick as a dog and hope and pray like crazy that you survive, and then if you survive, you're better off. To be perfectly honest, if I had my choice of my foot not hurting, or maybe the best way that I could do it is have the car run over my foot, and then after I recovered from my foot being broken all to pieces and everything, my foot would be better protected against somebody of it hurting. I would choose getting vaccinated, to tell you the truth.
All right, thank you, David. Next to Brendan Tierney with WSAZ.
Good afternoon, Brendan Tierney with WSAZ News Channel 3 here. My question today is for Superintendent Birch, because back when you released the state guidelines last month, you were talking about how important it was for kids to be in school, and some of those measures you had in place, like mask wearing and vaccinations and things like that, as reasons for students not to have to quarantine. So we've seen this week, just here in Charleston, even Capitol High School closing down for 3 days after there were a handful of cases across the school. Where does it come in, and what would you say is that point that a school should fully shut down versus try to stay open?
Actually, great question. We met with the superintendents last week, walked through some of those guidelines. No matter how hard these schools work on the mitigation strategies, most of them review those weekly if they see increases. And there's really 2 big cases that we've seen where schools perhaps may have to close down. But when I say that, let me be very clear. We're not talking about long-term closures. We're talking about very, very short-term temporary closures, working with the health department to where when they see, and let's all remember, we've seen these closures before, even when we've had major flu outbreaks. We've seen an individual school have to close down. Oftentimes when you see your attendance rate double or triple in a very short period of time, If you have staff, and I hate to say this, but if we have staff and they're not vaccinated and they have to quarantine and we don't have the personnel to keep that a healthy and safe environment, we oftentimes will see a school, and Superintendent Williams had to make that call with Capitol. It was a very short closure to try to get either the staff in or get through that quarantine period. And it goes right back to what we've been saying this entire press conference, or, and then for the governor for months upon months. We've got to get more adults vaccinated in order to stop that. The more folks we have vaccinated, they don't have to quarantine. It's right there in the guidance, as long as they don't show symptoms. So, us as adults, we have a lot to do sometimes when those decisions have to be made.
All right, thank you, Brendan. Governor, I'll turn it back to you.
Okay, I really appreciate the questions. I appreciate the concern. I go back to my notes that, here is Dr. Marsh just told us that 2,200 people in this country died yesterday. Almost a World Trade Center, incident that happened yesterday in this country. And we all know in life that, those that were living when the World Trade Centers went down, the towers, it scarred us, and we will remember that moment forever. And Dr. Marsh just told us that yesterday, for all practical purposes, we had the towers go down yesterday. We have become callous, have we not? And we've become almost immune in ways. You let me read 18 wonderful West Virginians that we lost, and it's like, well, it wasn't me, so what? And we just continue on. We shouldn't be this way. We really shouldn't be this way at all. I've read to you hospital numbers that said all across the board, whether it was in the West Virginia systems or the Thomas systems or wherever it was, 85, 92, 100% of those that were at Thomas in the ICU units are unvaccinated. 100% of them that have COVID that are in the ICU units haven't been vaccinated. Well, what does it tell us? It tells us over and over and over, we just got to get vaccinated. Now, if you are vaccinated and someone you know is not vaccinated, that doesn't mean you need to be critical of that person. Surely to God above, we don't need to be threatening people with death threats that, that are out there that are working so hard to protect you in every way because you think that they are mandating masks. We need to be respectful of our local school officials, whether it be our boards or it be our superintendents or whomever it may be. We need to be absolutely respectful of what they're trying to do as well. Now, at the end of the day, the argument that Bob brought up, and I think, no, it was David. I'm sorry, it was David that brought up, at the end of the one of the last questions that we got. It was just this, and this doesn't have anything to do with David's question. It has everything to do with what the idea or thought behind the question is. You've got a lot of people out there that believe, and I'm going to make fun of this in a way, but believe that if I've had COVID, I'm good to go. Well, the science that we have, that Dr. Marsh and everybody that we have says, no, you're not. You're not good enough to go. But you've got people that have never had COVID, that have never had it, that believe I don't need to get vaccinated because if I get COVID, if I get it and I get through it, I'm going to be in great shape. Now, what would be the difference? What would be the difference in this conversation? And this goes right back to this. Hey, Grandma, I'll tell you what let's do. Let's go over to June's house. June's got COVID right now. And let's get infected so that after we get infected, we'll be better protected. Now, you tell me how that would play. And grandma would probably say to the child that's making that recommendation just this. On the Beverly Hillbillies a long time ago, Jeffro was standing beside what he called the cement pond, their swimming pool. He had an anvil in his hands, and he had a chain tied to the anvil and tied to his ankle. And Jed, the grandpa, walked up and said, "What are you doing, Jeffro?" And he said, "My girl done dumped me. I'm going to throw this anvil in the cement pond and drown myself." And Jed looked at Jeffro and said, Jeffro, explain to me this. What good's that going to do you? And Jeffro just stopped and paused and said, Pert and I made a mistake, didn't I, Uncle Jed? Well, really and truly, that line of thinking is holding us back in a lot of ways. It's holding us back. The people that believe that in the vaccine there's tracers, that the federal government is going to trace you around and know where you're at, and you're carrying a cell phone, I mean, we got to get past this stuff. That's all there is to it. We got to get past the silliness. We got to get past that and get vaccinated. Absolutely, we don't want to be standing there holding the anvil and say, Pert and I made a mistake, didn't I, Uncle Jed? That's all I got. Thank y'all.